Good morning, good evening, good afternoon. This is your host with the most, and I hope it's not BS. This is Dr. Chris Rasmussen. So in this section, actually it's not part 3. Well, technically I suppose it is, but this is going to differ as we divide these up into approximately 1-hour segments, so as not to drive you insane having to sit down for more than an hour. Okay, so in this section here, we're going to cover a ton of stuff. So let's start with chest pain. You're going to learn to recognize that there are 3 subgroups that when they have chest pain, it's not going to be your classic chest pain. And I'm going to have you learn to recognize those. It's really easy. And that way you are not going to have to worry if that person hasn't what they call an anginal equivalent. Shock. What's the definition of that? This will help you if you need to dial 911. Coronary artery disease. Of course, CAD, as they call it. That's one of the largest diseases, greatest prevalence in America than anything else. And right along with that, myocardial infarction, heart attack. There's several different types you can have. You know, there's heart attack light, and then there's the regular heart attack. Both are actually ominous. You can die from either one. Heart failure we'll get into. The tachy and Bradyarrhythmias, hypertension, infective endocarditis, the disease you don't want to get, non-coronary vascular diseases. So getting into a little more detail, here we've got your bradyarrhythmias, and I'll show you real briefly how to interpret an EKG. So if it says sinus, sinus means it's coming from the atrium, from the sinoatrial node. Here's sinus bradycardia. Not necessarily a bad thing, but I'll tell you when it becomes bad. Bradycardia, flow chart, some of the things to think about when someone becomes bradycardic. First degree, second, and complete heart block. These are important to know. Just for your own edification, you wouldn't be able to tell from a pulse. You'd have to have an EKG. Junctional rhythm, that's another type. And then we get into the tachyarrhythmias, sinus tachycardia, supraventricular tachycardia, and then adenosine, which is the drug used to stop that. Junctional tachycardia and WPW is another disease that's fairly prevalent. AFib, of course, you all know this one. This is your classic irregular pulse. Atrial flutter, though, goes right along with that, and sometimes people are in fib flutter. Multifocal atrial tach, this is your typical choppy pulse. Ventricular tachycardia, these two here are both ventricular tachycardias, and they're both extremely dangerous. Number 16 is just sort of a general category. Torsade de Pointe is a special category and extremely deadly. And then how to treat it. PVCs, which are premature ventricular beats. This is often what patients, when they come in to see you, they'll be complaining of I can feel palpitations, or they feel their heart flip-flopping. It's often PVCs, and I'll give you a cutoff as to how many you should get worried about, etc. Atherogenesis, how do you get a plaque in the first place? It's not what you think. Acute coronary syndromes, in fact, with 20, I've got an entire seminar that I've done and presented to people all over California on the true cause of heart disease and how to prevent it using over-the-counter stuff. Acute coronary syndromes, different types of heart attacks, infective endocarditis, again, infection of your heart valves, which is really horrible. Congestive heart failure, I'll go into left failure, right failure, and biventricular failure. DVT, this is a deep venous thrombosis. This is a blood clot in one of the deep veins. And why is it important? Is because you can get a pulmonary embolism from it. And you can also have a stroke, and I'll go through how you can get a stroke from that. Hypertension, the silent killer. Not so silent. I've got some symptoms that you can remember that you should ask all your patients and then find out, because oftentimes they are walking around, they don't know they have hypertension. Of course, also you want to check a blood pressure. Acute aortic dissection, which is a terrible tragedy. This has your classic for the boards, the pain radiating, the tearing type pain radiating to the back. Aortic aneurysm is a ballooning of the aorta, and these are often medically managed. I'll show you a little trick you can do with your physical exam to assess the size of the aneurysm. Pericarditis, infection of the pericardium. Arterial insufficiency, this is what diabetics often have. And so you're going to see a lot of this. This will be the one where the patient comes in and says, my doctor told me that you can't needle into my foot. So that's arterial insufficiency, and she or he is right. You definitely don't want to. That could be a major lawsuit when they end up cutting that person's foot off. Okay, so venous insufficiency, this is when the venous drainage to the lower limbs doesn't work properly anymore and the leg swells up and ends up looking pretty awful. And it's a little shocking to students. I'll go through that. Peripheral artery disease, that's sort of like arterial insufficiency. Although you can have disease deeper and further up in the vasculature. This usually gives you claudication, which we'll talk about. And then you can get a blood clot, which can flow distally into a leg and cause the leg to decrease the perfusion to it and actually increase a series of signs and symptoms called the 6 Ps, which we'll talk about. And then some facts on heart disease, cardiometabolic risk factors. These are the things to be aware of that actually do cause heart disease. 17 daggers of inflammation, that comes from Life Extension Foundation. It's actually more like about 15 from them. I'll show you why. Metabolic syndrome, 65 million people have that, and I'll show you a really easy way to assess whether your patient has metabolic syndrome. And I'll give you a hint, it has to do with a grain belly, not necessarily a wheat belly, and I'll tell you why. Microalbuminuria, this is leaking protein in the urine. This is a tip-off to endothelial damage, which is precursor to many, many diseases, including heart disease and stroke. Inflammation promotes thrombosis, that's a blood clot, and you bet it does. Inflammation also promotes cancer and all the diseases of Western civilization, which I talk about in my book at length. Fat is not inert. Yeah, definitely. All fat is not bad either. There's good fat too, and that's dietary. And then the fat that's in your body is in 2 forms. They're both metabolically active, and we'll talk about it. Here's how we walk the dog. It's a presentation from a fella in Chicago, blocking the renin-angiotensin system and ACE inhibitors and the blockers that go with it. So that'll be it for this cardiovascular lecture, and I hope I've enticed you. And believe me, if you know all this stuff, you are going to know a hell of a lot and way more than you need to know in order to prevent any problems occurring with your patient when your patient doesn't look right. And I'm going to walk you through every single one of these. No problem. Okay, thank you.